What do you want to say?
Okay, so let me introduce our guest for today. So we have Dr. Billy Choong, the founder of Dental Genesis Network and the principal dentist at Quest Dental. He plays the piano and he speaks in 4 languages, if I count it correctly.
Dialects, if you include dialects.
Include dialects as well, that would exceed it. So as far as I know that you are well versed in Chinese, in English, and also in German, right?
No, German, no, very little. The 4th one will be Cantonese.
Very little. Oh, Cantonese. I see.
Yes.
Okay, right now is 2:15 at my time here. So let's start straight away. Okay, so Dr. Billy, glad to have you here today for our session of DEFY limits. And here's the thing, right? When I look at when you started Quest Dental, there is something different about your practice compared to others in that you emphasize not just in doing the job, right? Not just in flossing, in whitening, but to actually create an environment that is comfortable for your clients. And you emphasize that you want to have create a conducive environment for everyone, not just the your clients, but your dental assistants as well, and everyone involved. So can you share with us what is this vision of Quest Dental?
Well, first of all, Quest Dental was built to serve the people. Dentistry has changed quite a bit over the last few years, especially in Malaysia. Last time people become dentists, they don't need to worry too much about service because the demand is so high. Everybody need dentists, and there were so few dentists in the market. But now it's different. Now, over the last 10 years, we grew from, I must say, 4 or 5 university to now we have 13 or 14 dental university. So we are churning out a lot of dentists, and that brings competition. And most of the people, I think across all other industry, there are 2 ways to see competition. One is a good thing. The second one would be a bad thing. Bad would be if there are more competition, it would be more difficult to survive. But the good thing is we can see it as the motivation. So now in Malaysia, dentistry has slowly moving into a service industry rather than just reselling a treatment. So there's a very famous saying in dentistry, especially in a more developed country. They say that we are treating the person, we are not just treating the teeth. So Quest Dental was built based on philosophy at the back. We don't just want to do a good quality treatment. We want to create a good experience, and the experience starts before they come into the clinic and also after they leave the clinic, meaning from the first touch, how they get to know us, and then they got in touch with us, how was the phone call, how was the conversation like on Messenger or WhatsApp, and then how was the first impression before they step in, but before they talk to our receptionist, what was the first experience, the environment, the music, the smell, and then how was the receptionist handling the patients, and of course throughout the whole treatment, was the treatment painless, was it comfortable, and then after the treatment, how was the follow-up. There's no, in dentistry, just like anything else, there's no 100%. Some of the time there must be something go wrong. How do we handle when something go wrong? So this is what we strive to do better and a more holistic experience.
Okay, that's a good sharing from Dr. Billy's part. Actually, look at the comment section, and Peter actually asked that do you think we have too many dental school graduates? What do you think, Dr. Billy?
I personally think no, because in, let's say I give you an example. In India, probably they are looking at one dentist is facing about 60,000 people, the population. So if you spread it out, one dentist has 60,000 people, and they are then go starving, like they got no business, even though they have 60,000 customers. If you look at places like Hollywood in America, one dentist probably are dealing with less than just 100 people, and most of the dentists are doing very well there. So we have increased tremendously of how many dentists are graduating now, but they are still not enough to serve everyone with a high quality service. So no, not yet.
So talking about high quality, right? So David actually asked that is there any continuous professional training that dentists actually need to undergo on a yearly basis to keep themselves updated? Because there is a lot of innovation that is happening in these couple of years. What do you say, Dr. Billy?
Oh yes. Oh wow. This one I have to dissect into different sector. So first of all, let's talk about dental school. I think this is very similar in any healthcare or any science engineering sector. Whatever we were studying on the textbook, usually very old, because they take a few years to design a research, take another few years to complete the research, then take another few years to finalize the product or the theory, then it takes another few years to write it into book. So by the time we read the book, it's already too late. So, but then that's saying dental school, the purpose is to give us a very good foundation so that after we leave, we know where to get the knowledge we still need to get, right? So dentists after they after we graduate, we still have to go through a lot of things. For example, braces. Usually in dental school, we don't learn about braces. Implant, we don't learn about implant. Some rather difficult surgery, we don't do much in dental school. So those are the things that we have to go for extra courses. And that leads to another topic, which people keep asking why dental treatment are so expensive. So sometimes with very close patient, I tell them, let's take an example of wisdom tooth surgery, removing wisdom tooth. In the market now in KL, usually the price range between 800 to 1,600. If it's done by a specialist, probably it go up to 1,000 plus. So then they will ask, why is it so expensive? So with a very close patient, I usually tell them the cost for the whole treatment is basically the one disposable knife and the thread to suture up, to close up the wound. So it probably cost us about 20 or 30 ringgit. So then I said, I can even give you the knife and the thread, and you can do the surgery yourself. So the most of the fee that we're charging basically is based on our time and the knowledge that we go through, because on average every year one dentist probably have to spend at least 10 to 20,000 every year to keep up with the new technology and new technique. So those are the value we bring.
So it's interesting that you note that dentists actually only get like really foundational stuff at their school, and they actually have to come out here and learn about a lot of services that they are actually offering to their clients are actually things that they learn outside from their school. And is
Yes,
there a
yes.
required CPD hours like per year?
Come again?
Is there a require CPD hours like continuous professional development?
Yes,
Is it mandatory?
yes, there is. But if I have to put this very, very carefully. At, at this stage of the development of the industry,
Yes.
the requirement for a very, very motivated and motivated dentists who want to excel, the requirement to them is very low. So usually, a normal motivated dentist probably every month, every second month will go for a new courses or a weekend seminar. So that will probably double or triple the requirement already.
I see. I see. Here's the thing, right? I've known you for a couple of years. Time really flies. Although we don't always have to
What's that? Probably
catch up.
4 years, 5 years.
I'm not sure, but it certainly seems like time flies really quick. And through these 4 to 5 years, I can actually see the growth of Dr. Billy. I've been seeing you traveling around to meet dentists with good dental practices. Like some of them have a great curated environment, some of them have a certain skill set. And you are actually a member of a couple of dental associations. Do I get that right?
Yes.
You're actually the Malaysia Dental Association, of course, and you are also with the America and Chicago Dental Association.
Yes.
Is there a necessity to do so? And how do you see the difference between dental practices that we have here in Malaysia versus the one that you have seen in your travels around the world?
Let's put it this way. The necessity I see to do all these things means traveling, attending conference, not just in Malaysia, also in different countries. And whenever I travel, I would visit. Most of the time, I talk to my friends, ask them if they know any of the good dentists in that particular city. If not, I probably would write to the dental association in that country and ask them who are the famous dentists there. So and I will pay them a visit. Whether is it a necessity? It depends on where a person want to go in the career and what they want to do. If you just want, if a dentist, which is nothing wrong, I think it's a smart choice. If one dentist just want to work under a group and then to work to 45, 50 years old and retire, I don't think that is necessary. But I knew I was going to open a dental clinic, and then part of my ego, I don't want to open just another dental clinic. I want to be a little bit different. And then also, if I do something very ordinary, means anybody can do better than me. So I realized that it's not really that much of a mystery of how to do different from other people, because within Malaysia, our dental industry development is still rather slow compared to a lot of other developed countries. So I figure maybe I can get some idea if I visit their dentist and then bring something back here. So that was the purpose. So to me, it is a necessity, but not for everyone. It has to depend on what the person want to do.
I would say that is actually a strong point. As when you first started back when you are in the university, I can see that you are someone who is very driven. You will keep on learning, you keep on exploring, you keep on upgrading your skill. It is we can say that it's rather a quick rise for you as well, because you are really hungry for it. Okay, here's the thing. I've been looking at the comments, right? I feel like a lot of people are still not very clear about what does it takes to become a dentist. How many years do you need to study? How difficult is it? How long is the coursemanship?
All right. We start from secondary school.
Yeah.
So after secondary school, you graduate. You have your SPM. That's what we call O level, right? So you have O level. Then you need a pre-U. It's either your STPM or your A level or your SAM. My case, I did UEC in Sunjin High School. It's a Chinese high school. And then after that, you go to apply to dental school. So what is the criteria? It depends on the school and also depend on what pre-U system you do. For example, back then I thought my path was quite easy because that year, my year UEC, I believe the standard wasn't as high as the year before. So I scored pretty okay. And then the requirement, because all the university think that UEC is very, very difficult. So the requirement for people who apply with UEC is very low. So I got in, I think they just require me to get 1A and another 2B for my science and mathematics. But let's say if my friend who went through SAM, which they did in Summer University, I heard that to become a doctor, a medical doctor, they need to score like 90, but to become a dentist, they have to score 95. I think to me that makes sense. So, it depends what route you take, and of course, then if you go to government university, STPM is a very strong route to go there. So dental school in Malaysia and in most of other country is 5 years. After 5 years, you graduate, and then you have to work for government for at least 1 year. At this moment, is 1 year minimum, and then you are free to practice in private or anywhere, or you can open your own clinic. So that's basically the route.
So to sum it up, it's about 5 years of study. Then you have to serve with the government for 1 year, and then you are free to open your practice.
Yes.
Okay, here's the thing. What kind of specializations that is available for dentists to pursue?
They are actually whatever you think of, they are specialization. We have in Malay, but officially in Malaysia, the category, I think there are 6 or 7. You have first what we call pedodontist. We treat kids, so that's a specialization. By the way, to become a specialist in Malaysia, is you need to study at least 4 years postgrad. So let's say if you go to a university, the postgrad master course is only 3 years. You come back, you have to attach another year, then only you can be called specialist. So that's sorry, we go on the side a bit. But we have pedodontist, that is the kids. We have endodontist, that's for root canal. We have orthodontist, that's for braces. We have prosthodontist, that's for like denture, bridge, crown, veneer, anything, any prosthesis, the fake teeth. And then we have surgeon. Surgeon is those surgeon you basically in Malaysia, if you are a surgeon, basically they have done cases like half of the jaw is gone and then they have to reconstruct the jaw. So that is pretty intense. After that, you have what we call community health or community oral care. That's basically people who are interested in doing research and study and more survey to see the whole trend of dentistry, what things are, what are the direction that the dentistry is going. So this is basically the 6 very common in dentistry.
So one more thing, right? So once again, for all the viewers, if you have any questions, you can always write at the stream comment on your right. We will look into it, and Dr. Billy here is here to answer your questions. It's not always that we have all these guests, right? But now it's the MCO, everyone is at home. So Doctor is free a bit, but he still have to work essential services, right?
Yes, it is.
Still working. Yeah, so
I
glad
think
to have you here.
other people, if they want to work, they have to write a letter. For us, is if we don't want to work, we have to write a letter.
Oh.
We are forced to
That's
work.
why that day I was catching up with you, and then oh yes, you're actually still working. So thank you for spending an evening with us. So
No
before we
worries.
move on to the business side, right, and all your other networking experience, we want to, let's just say, clarify on like one final thing, right, on dentistry.
Sure.
So far in your career, what are the common dental myths that we have?
Awareness. Awareness.
Yeah.
That is the one single most important need. I think in a lot of the countries. Um, for I give everybody works well with numbers. If a normal thief every year you spend, say, you go see dentist twice for cleaning, you spend between 200 to 400 for 2 times cleaning, depending which part of KL you go. And then every year you do one more extra, you top up another 100. So it's 300 to 500 ringgit, right, to take care of your teeth. That will help tremendously on how you keeping the teeth good. And let's say one day you have a small hole, very small cavity in your teeth. You do a filling. It costs probably around 160, 180. And let's say if that day you decided not to do it, the cavity become bigger, and then it probably costs 200 to 300 or 400 ringgit to fix it. And then if you still don't fix it because there's no pain, usually the cavity, if it grow very slowly, there will be no pain. Then it grows so deep until it touch the nerve of your teeth, it become that you need to do a root canal. And that will cost you almost 1,000. If you go to a specialty, it costs you a few thousand ringgit. Plus you have to do a crown on top, another 1,000 plus ringgit. So let's say root canal, you still don't do it, then you have to take out the tooth already. You take out already, you want to do an implant to replace the tooth again, that will cost you close to 10,000. So a very common saying within dentists, but we are trying to get the message out, is dentistry is not expensive. Negligence is the thing that's expensive. So just now I think Peter, right? Peter asked whether there are too many dentists graduating or not. I say no, it's because I think 2 years ago, Ministry of Health
Yes.
did a survey. 90% of the adults in Malaysia got gum problem. So turning 90% of the adult with gum problem means there's about I think 17 or 18 million people above 18 years old. There are that many people have gum problem, and gum problem means people don't go and see dentists regularly, right? So what is the most common problem and the biggest need for the public is the awareness has to be there. And it's not their fault that they don't have awareness, because they just don't know. I don't know whether their mother didn't teach them, or they themselves don't know. It's the fault of the dentist, because we have the knowledge and we have the power to change that. So dentists are not doing enough to raise the awareness. Therefore, that is the greatest need for the public in terms of dentistry.
Which is also the reason why Dr. Billy right now is doing educational videos. Right.
No, that's because of MCO.
Yes, because of MCO, right? For 14 days, your goal is actually to produce 7 educational videos. So
yes,
where can we see?
unfortunately, I'm delayed a bit. I have 5 videos so far.
2 more to go. 2 more to go. So where can we see all these videos if the viewers want to see? Your Facebook page.
It will be on our page. It will be on our page. I'll see whether I can pull this out. There is, if I post it into our private, because I can't comment in the live chat. So if I
You
post
can't
it,
comment in live chat?
can I post
Sure,
it on
sure.
the private chat? And then
Sure.
you forward it.
Sure. Yep.
So
Is it the Quest Dental?
correct. Quest Dental Malaysia.
Quest Dental Malaysia. All right. So here we go. Yes. So for the viewers who are watching this, if you would like to see some educational videos from Dr. Billy, make sure you watch all 7 of them. It will be available at our Quest Dental Malaysia Facebook page.
All the
I think
video
one of
are very short. All the video are very short. It's within 2 to 3. And we are not using any technical term. It's all, as long as you can go order a coffee in Starbucks, you probably can understand everything I say in the video.
I think it's fitting for our short attention span nowadays. No, yeah, which is also why if we look at the testimonials for your clinic, right? Most people actually appreciate the fact that you actually took the time to educate them on the good dental practices. So it has become really like what you call service. You have to go the extra mile. It's not just about extracting a tooth.
Yeah.
Yeah.
We always try to save the tooth. Come again?
We can actually see that Feng Chuan actually have a question, right? So how do we conquer the fear of seeing some blood?
That one,
Yeah, are they dentists that are actually, do they freak out over blood? Any of your first year?
I had a classmate before, but
Yeah.
he went, no, she went overseas, and then but she graduated, so I think she conquered it already. This one is more of a psychology problem, isn't it?
Yes.
But
Is
I
there
think
like a method that is recommended by your professor or the association? Is there like a best practice on how you actually overcome? How do you stay calm? How do you
I
overcome
think
phobias?
if Lim Fong Chan means a person, if a person want to be a dentist but that person is a blood, if that's the direction where the question is going, I think the sequence is wrong already. It means the person have to conquer the problem of seeing blood before they come in to become a dentist. But of course, there are things that depending how bad it is, it's like a drop of blood, pain, then probably definitely. But a small blood, like when you brush, you see blood, those are acceptable. Probably they can go to the direction of doing braces. But how to conquer? I think you see more.
See more
You
exposure,
do,
reduce the fear.
if the desire to
Uh-huh.
become a dentist is so strong, they are willing to train themselves out to see more. Like roller coaster, right? Like you are afraid of roller coaster, but you want to go, so you just go from the smaller roller coaster then to the bigger one. I guess that's the concept. But I can give you another relative, which my experience is. I used to be very needle, but now I'm injecting people almost on a daily basis. So that one really come from practice. Uh, the more you do, the easier it will be for you. But then of course, I really have to want to do it. I'll take the first step to improve on it. So I guess it's exposure. The more you expose to that, and then you will overcome it.
Would you say it would be similar to when you started to practice public speaking? I believe you have a couple of mentors on that as well, and you took on probably some NLP, some communications, some guide here and there. Would that be similar to how you overcome? How would someone overcome the fear of blood? Would that be the same?
Yes. No, I didn't take out NLP, but Toastmaster helped a lot.
Toastmaster.
Yes, Toastmaster helped a lot.
Yeah, for those who are unaware, can you share with us what is so special about Toastmaster? What is in the system? How do they train all these speakers?
In Toastmaster, most of the people say if you want to learn how to do public speaking, you should go to Toastmaster. That gives people a perception that if you go to Toastmaster, it's like a classroom. They're going to teach you all the technique how to speak. But to me, that is the most valuable part of Toastmaster. The most valuable part of Toastmaster is you go inside, you have to speak in front of an audience, or shouldn't say you have to, you can speak in front of audience regularly. Even if you want to do twice a month, you can do it. So the most valuable part of Toastmaster is that they give you an audience and they give you a stage, and the audience are good quality audience. It's very difficult to find a very good quality audience. Like you just picked up violin, you try to learn to play violin, and then your family are like, stop playing, stop practicing. You are not going to improve. But then in Toastmaster, doesn't matter how bad you are, they will cheer you out. So the practice, the good quality practicing stage is the most valuable part of Toastmaster. And the Toastmaster Club is there. We just have to go join it and then follow it. But back to the system, they basically have a structured number of speeches you have to do. They're from every speeches there are requirement. So like the first speech will be whatever you want to say about yourself. So that is basically they want to see where you are, what level are you now. Then the next speeches they add a little bit more element. They say they teach you how to construct your speech. You have to have an opening, you have to have a content, you have to have a conclusion. Then some of the speeches teach you how to do use your voice, and some speeches teach you how to use your gesture, your hand. So it's quite structured, but to me this is secondary. The first is the stage. They give you a very good stage.
A platform.
Yes.
So Toastmaster is actually not a club where you go and attend lectures. It's actually a place where you meet other peers to practice public speaking. So would it be fair to say that it's a peer evaluated system, but you all are actually being equipped with some manuals on what to do?
Yes, it's like that. What I think most of you have heard this before. If you read the book, you learn probably about 10%, and then if you do it, you learn about 30%. And if you teach people, you learn the most. I think there's a quote goes like this. So in Toastmaster, it's the same. Everybody gets to be the speaker and also gets to be the evaluator. Means let's say today I will be the speaker, and then Terence will be my evaluator. Parents have to tell me what I did well and what I can improve on, and vice versa. Maybe next week we swap our place. That will be a speaker, and then I'll be on my side. Obviously, Terence speak better than me, so
Debatable.
but that does not mean that there are things that I see when he's speaking. I can find something that he might miss out from my point of view. So yes, it's a peer evaluating platform with a very structured system. I think if you go visit once, you would probably get about 70% of the system, how it works. It's a very simple but effective system.
Okay, so we have delved a bit into the Toastmaster side of your story, right? Currently, you are actually rather active in BNI. I think in our viewers here, there is one or two that is actually from BNI as well. So what do you think is the value of BNI? What kind of structure, what kind of system do they have in place to help people to network and to refer businesses better?
First of all, the structure of BNI is very similar to, if you heard of Rotary, if you have heard of Toastmaster. So they have an international organization. Then they split the whole into district. And then within a district, they have their individual club. So every of these organization has a different vision and mission. So for let's say for Rotary, Hugo, Terence and I are both in Rotary, but different club. Our goal is to do community service. Toastmaster is to cultivate leaders and speakers. Whereas in BNI, it's basically a place where we build and help each other to build our business. It's very straightforward. When you are there, you don't need to be shy. You just tell people, and you should. That should be your main reason. You should be there because you are trying to look for business. How it worked very well is because we call it a group, we call a chapter. It's like a club, a group. So in one chapter, you can only have one person from one profession. Means if I'm a dentist there, the other dentist cannot come into my chapter. So in my chapter, we have 80, now it's 80, 85 people. So there are 85 people who are either business owner or person can make decision in a company. So there are 85 of them in different industry. And these people see a lot of people every week. So how the meeting go would be there. Of course, you have your president addressing and then some reports, but the most important 3 rounds of the BNI every meeting is first round, every member gets to have either 20 or 30 seconds, depending on the culture, to introduce your business. So for example, I would say, my name is Billy, I'm from Quest, and this week we are doing a promotion on whitening. If you know anybody or meet anybody who need whitening, please come and see me. So everyone has 20 seconds to do it. Then the second round, every week we choose 2 members to have a longer time. They have 7 minutes each to present their business. So they are starting of the business, what's their unique selling point, who are the target customers looking for, how can we help them to look for more customers. So they're educating us to be their ambassador. So every week we have 2. So this is the 2 round where we sort of pitch ourselves. And then the third round will be we start to give, means the mic go around the room again, and we will stand there and say, this week I saw 2 patients, one of the patients want to buy a property or another patient want to buy insurance. So I refer one patient to the insurance agent and I refer one person to the property agent. So some other people, let's say Terence met somebody need to have a teeth checkup. So he will refer the customer to me. So this is how we do a referral system. So to me, for SME, small and medium company, they are the best for BNI. BNI is the best for them. It's very efficient.
You mentioned that your chapter has 85 members. Right. Do I get that right?
Yes.
How effective is it for 85 people to gather in a room and everyone is trying to pitch their products or services? As a small and medium enterprise entrepreneur or business owner, when they get in there, would that be too congested to be effective?
Depending on the culture, but in general, most BNI chapter, they are quite supportive with their member. The others, for example, I had a printer before, like person who do my printing.
Okay.
But there was a new printer join our chapter, so I will automatically, whatever possible work, I'll pass to the BNI, the new join BNI member who is a printer. So we are quite supportive. But of course, like you say, when the chapter is big, it takes longer time to get to know everybody. But not impossible to do it in a short time. For when I joined BNI, that was about 7-8 months ago. That time we already had 75 or 6 members. So I realized it's very difficult because you go to a meeting, and then everybody do their thing, 20 seconds, go one round, and then the other round, and then everybody have breakfast, and then we leave. So there wasn't much interaction time. But BNI has another section or another system called one-to-one. We are encouraged to meet up with one member, one at a time. We spend probably about 1 or 2 hours with each other, and then I'll talk to him about my business and also my personal life, and then he do the same. So by doing that, we really get to know one person. So my strategy was that time when I just joined, every week I did about 6 to 7 one-to-one. Means I meet up with 6 to 7 people every week. So over 3 weeks, I cover about 20 over people. And when you are close with one of the few people, and those people will bring you into the bank. So it becomes easier. So it's not impossible. I think the facility is there. It's how we use it.
I would like to quote you on something, right? I think this is probably something you said probably a year ago, right? You say something along the lines that people thought that networking is about getting referrals, building reputation, getting exposure. But for you, the greatest value that you get for your business is that you get to know reliable friends.
Yeah.
What do you mean by this statement? How does this apply to your business so far?
If I didn't know, Terence have a friend called Victor, and Victor is my patient.
Yep.
So if I don't know Terence, Victor would know me, and then I wouldn't get to solve Victor's problem on his teeth. But I think one of the person told me about networking. Something, the word he used was organic networking. So
Okay.
what he defined organic networking means when I meet a person, I have no specific business intention behind me. I just want to know a person, and I wouldn't know when I need him or he will need me. So if we do that enough, doors will open, and when doors will open, we already have the network for us to ask for help or something. So this has been most of the time that when I meet people, I try to be genuinely interested in that person. That doesn't sound right. How can try to be genuinely? But
either you are genuine or not.
But you get what I mean. So I really want to know that person because a lot of the time, one of the things I learned very important is a lot of us we can't help. We just judge a person first impression, like without even talking to them, knowing that we just. But I always try to support that and then try to get to know the person a little bit more before I make a judgment. Even if I've done that, it has proven that my judgment could be wrong. But that is a very good starting point where I meet someone, I just want to know what they do, what's their story, and if we click, then let's keep in touch and be friends.
I think you are onto something here. We are onto something. We are basically talking about some of the lessons, or should we say networking strategies that you have that allows you to actually build your career and business rapidly over the times. And one of the things that I recall clearly is that you mentioned in one of your blog posts, right, that you prefer to mingle with those who are more elderly. Is there a particular reason behind
that one? I think because I just find what they say or what they have got to say is more interesting than I think back when you say back then, it's about 6 years ago. I was in
possibly.
Yeah, I probably because that time we met each other in Rotary Club, Bukit Bintang. So I was still student. So
Yes.
at that time, I don't find computer games, Netflix. That time, Netflix not so popular. Probably some of the series or K-pop. I don't find that interesting. So, but that was the thing that my peers was crazy about. And then I found out that elder people give us some different perspective. It's like a time travel machine, you know. You
Okay.
I always think that what would I be when I'm that time? Would I regret on something or not? So talking to elder people sort of give me an insight, like foresee if I don't do this, I will end up like them, or if I do this, I will probably become like them. So I enjoy knowing that and help me to plan what I want to do next, which I can't
There
get.
is one common question, right? So I'm
Ah,
getting this by WhatsApp.
yeah.
Um, so the question is, how does one actually find a mentor? How do
Oh,
we get about finding a mentor? Right? Where does mentor come from? Is it is it you actually have a set aside on someone, certain someone to be a mentor, or does it happens, accidentally? How does one goes of this? What do you think?
last time, last time just started to do some public speaking, and then this is
Yeah.
one of my topics. But I have changed my view tremendously. I
Okay. Okay.
I
Good to
used
hear.
to think if one person really really want to get a mentor, there's a strategy to get a mentor, but uh, I was wrong mostly on that. Uh, Looking for a mentor, it depends on why. If you just want to have a mentor or having a mentor, then there's no reason. But if let's say you're in a project and then you uh, found you know about the project, let's say take me as an example, it's a dental project. I want to start the practice. Then I realized that in school they didn't teach me about how to hire people, how to do my account, how to train my staff, how to do marketing. If I don't know that, I can't open a clinic. But I really, 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 really want to open a clinic. So in that way, along day to day, I'll meet people, I'll talk to people, I'll ask people. Then from there, somehow I will find an answer. And one of the way to get an answer is to meet somebody who can teach you rather than you just read something. So maybe one day I ask somebody and then I realize, hey, that person really know a lot about starting a dental practice. And if we click, then we become, then he could be my mentor on this, and then I will be the mentee for him on this. So I don't think getting a mentor is the goal. The goal is to get something done, and then getting a mentor is one of the way. And there are things that we can do to increase the chance of getting a mentor to solve the problem. But there's no guarantee.
In your own experience, in
Yeah.
what ways have your mentor deeply impacted you? Maybe on certain ways of your thinking, or perhaps on your skill set.
Mhm.
In your personal experience, how does it serve you?
Mm, I'll put this
Mm,
into it it affects tremendously
mm,
because mentor is a human being and
yeah.
mentee is also a human being. So human are
Yes.
interacting.
Mm,
So we are highly prone to being affected by the person that we hang out with the most, right?
mhm.
So, let's say this really happened to me. I
Okay.
live in and there's a restaurant that I don't go. And then
All
there was
right.
one time came out from Singapore, and then we end up near. He came to my practice, and then we
Mhm.
decided to have, and then we don't want to go so far, so we end up in this restaurant, and happen for another few visits when they come here for certain lunchtime. We always go to their restaurant. And now, when he's not here, most of the at least once a week, I'll go to the restaurant for dinner or for lunch. So I think the more you spend time with the person, you picked up some habit from them. So mentor, if you spend enough time, they will affect you to become more like them. And therefore, like I think Warren Buffett say that you will become the average of the five people that you spend most time with. I think that is quite true. So if we want to become them King Chao, we have to mix with 5 very King Chao people and then spend time with them.
It's like, show me your friends and I'll show you your future, right?
That's Dan Pina.
Dan Pina, yes. I think there is another quote that people has always repeat is that who you are in 5 years is mostly about the people you meet and the books you read. How true is that for you?
Come again, the 5 years?
Who you are in 5 years will be mostly influenced by the people you meet and the books you read.
Oh, that's very true. I think that's very true.
Are you a reader yourself?
Sorry, I go back to that. I will remember that.
Yeah.
I just saw Lim Pong Chan say, not sure if the mentor wants to accept us or not. That is very interesting because that's part of what I used to believe. Although I say my belief was wrong, but now for that particular part, I still believe in it. The question I usually ask my audience is, does the mentor choose us or do we choose the mentor? And my always we choose the mentor, right? If one day I make friends with Michael Jordan want to be my mentor. But let's say just out of nowhere, I know Michael Jordan and Michael Jordan want to be my mentor. But my goal is to be a footballer. So I cannot choose him to be my mentor. So we have to decide what we want to learn, what goal we want to achieve, then we choose the mentor. Whether they accept us or not is the other thing. But we have to know what we want to learn first, then we can choose the right person.
So we have to be clear about our direction.
About leader.
So we have to be clear about our direction first. Then we try to seek help that is relevant to our goals. Basically, what you are trying to convey.
Yes.
So let's sum up what we have been discussing so far, right? We have talked about your dental quest, right? Quest dental, your practice, your vision. We talk about what is the requirements to be a dentist. How are practices in Malaysia compared to those that are abroad? And what kind of education that a dentist should continue to pursue? How to overcome fears such as the fear of blood? How you overcome fear, like your fear of public speaking? Why Toastmaster is a great system? Why BNI is a great system as well? And now the mentorship part of it, right? Now here is this one question I want to ask, right? So far in your business, right, and in your career, challenge that you have encountered, and how do you overcome that?
The first question, the first answer to the first question is the biggest challenge is now. I mean, I say that as if I'm already there, but the truth is I just started the business. But whatever I say is something that I believe, and that determine what I'm doing now every day. So the biggest challenge is now we just started our clinic, and then of course it's not cheap to start a clinic. We have tremendous pressure. We just have to make it work. So how to overcome that? I will say my strategy, but I will confirm with you in 1 or 2 years whether my strategy worked or not. The first thing is basically we have to be really, really positive because if I started my day with a very bad mood, usually I have a difficult time to stay very, very focused when I treat patient. So the first thing I want to solve is every morning I have to have a good start. I have to have a good start. Whether sometimes I do meditation, I talk to my dogs, or I watch YouTube, whichever thing I know that if my mood is bad, my work will be bad. So first thing, I have to be positive all the time. So the second thing is like now the situation seems to be very bad. I spend probably half a day to think, oh, everything is so bad, so bad, so bad. But after that, I have to find the good thing. It's like you, in the pile of shit, you try to find the good thing in it, and then you focus on the good thing. So the good thing is now there are less patients. I got a lot of time to re-strategize my operation, polish up the operation between me and the nurse, do a lot more training, do video on social media, finally learn how to do video content for social media. So these are the good things that I can focus about. Because if I focus on the bad thing, there's nothing much I can do. I cannot go out and catch everybody who go out of their house, but I can control what I see and what I can control. So stay focused on the positive side. That's my strategy. And then the general thing, never give up, believe in yourself, have good friends, talk to Terrence, watch and follow Terrence Facebook.
Probably should put a link.
So these are the strategy.
Yeah. So how do you see the dental business going forward? I mean, it has been a rather challenging year. There's a pandemic, there's a recession. Do you think the dental business will be affected? If so, why and how?
It will be affected. It will be affected, but there is also a chance. Let's go back to numbers. Numbers is easy to understand. We say, let's say for just now we say if you should spend about between 3 to 500 a year on your teeth. Means see that is twice for cleaning and then check out and also do X-ray just to make sure everything is okay. So a lot of people think that 3 to 500 is very expensive, but then there are a lot of people that spend 17 to 20 ringgit on Starbucks every week, at least once. So let's make it easier. Let's say 20 ringgit every week. 4 weeks is 80 ringgit. That's 1 month. 6 months is 64, it's about 400. Just half a year. Half a year is 400 ringgit on Starbucks. So I believe that there are still big portion of people that can afford dentistry. But the key is how can we get them to spend the money on their teeth instead of spending on Starbucks? So whichever dentist can figure out how to do that will be the one that survives.
Why don't you share with us? Actually, among the many services in in an average dental clinic, right? What is the service that is what is the most in demand service?
In demand
What
service,
do you go to a dentist for? Is whitening the big thing now?
that depend highly on the target market. And for this is very general because it can be different, but a very rough general. Let's say for older generation, average income, maybe retired, their highest demand is probably denture, extraction. They probably will come to you every 6 months for cleaning because that they are not trained or they're not educated in that direction. Okay, so now because of the social media, and then you have all the Hollywood things, so the younger generation, they are going more for
Aesthetic.
aesthetic. Yes, exactly. So
Mhm.
go on aesthetic, so whitening, veneers, but then also have to see which market.
Mhm.
But all everybody should have at least one toothache in their whole life. So to whichever dentists are very good at solving toothache without any discomfort, they will be in high demand. But that brings me to another
Mhm.
story. A lot of us who just graduated, we are really uh, uh, we want to learn about how to do braces and implant as fast as possible, but forget that the basic, like everybody needs kind of dentistry, is our scaling, cleaning. Scaling means cleaning, filling, simple root canal, simple crown. These are the things that actually are the bread and butter and build the practice up,
Mhm.
the implant. Because as a young person, I would consider myself young person come out. I tell people I'm going to do implant for you. Most of the people
Mhm.
don't really trust me. They probably will go for a more experienced dentist.
Okay.
If I learn the skill, but I got no patience, I basically pay the money to learn the skill for nothing.
I think Dr. Bailey, you raised an interesting point. As in, I mean, currently you are the principal dentist for Quest Dental.
Yes.
Is your own practice. So,
Yes.
and of course, as you say, right, you still appear young looking. How do you overcome the how to say, the perception, right? That I mean, nowadays there are a lot of young entrepreneurs out there that are trying to start their business, but they have to overcome this hurdle, right? This hurdle of other people perception that if you are so young, you're probably inexperienced. I want to be
Yeah.
in a capable hands, like it's
Yeah.
old looking, with white hair. How do we
Yeah.
overcome this? Category?
Uh, I'll start with my friend first. My
Yeah.
friend, my friend who did a twin program, did 2.5 years in Malaysia and 2.5 years in New Zealand,
Mhm.
and
Mhm.
he's working now in Singapore. So
Mhm.
he same problem. People who come in the clinic and ask him, "Hey, doctor, how old are you?"
Mhm.
So a bit fed up. So he went to eating shave for a while, and then he went to dye his
Mhm.
gray on the side, and then
Okay.
the problem was gone magically. But of course,
Mhm.
I don't want to do that. My way is because uh, I believe. Have you ever, let's put it in a more easier way to be related to. Have you ever buy something or buy a service from a person
Yeah.
that you trust, but that person is charging you slightly higher than other people? Even then, you buy just for the
Mhm.
sake of trusting that person. You are in a good hand.
Mhm.
So
Mhm.
I think most people have had that experience before. So I don't.
Mhm.
Age is a factor. Age, people,
Mhm.
and then they relate that would equal to our experience. But then
Mhm.
ultimate thing why the person choose me or not choose me is because the person like or doesn't like me. So if they don't like me, how old I look, they also won't come to see me. If they like me, they are comfortable with me, they trust me, then they will come to me. So in order to
Mhm.
overcome that, I focus a lot on relationship first. Means when the patient come in, uh, we spend time to get to know the person first, and then we have a conversation going first. Then I can sense the person that is comfortable with me. Then let's talk about your teeth. But of course, coming with a toothache very painful already, then I won't ask you nonsense lah. I won't ask you, hey, what did you eat for lunch? How did you come here? Hey, is there any traffic jam? But
Uh,
if you haven't toothache, I solve the problem first. But if your
yes.
normal person come in, we try to get to know the person because that also helps us to do a very good treatment. every person come in, they have expectation. Some people want to have beautiful teeth. Some people just want to be able to chew. So these are very different treatment we have to provide to them. So we have to figure that out first, what they really want. Then when we talk to them, if we are so good at sensing what they want, we talk to them in their language and tell them what they want to hear and what they really want, and of course what they really need also. We can't simply go and advise non-needed treatment, but talk in their language, the trust will be built. And then if that trust built already, age is not a matter anymore.
All right. I think you have raised some important points, right? It's all about building the relationship, the trust. So
Yes.
when the trust is there, then people naturally want to work with people that they trust. They also possibly do not mind paying a little bit more premium, just to know that they are actually in a familiar hands, right?
Yeah.
You gotta say that.
And on top of that, I actually gain patient by telling them what I cannot do.
Okay.
So they want to come and see me. They want to do certain thing, and I say this one I really cannot do. I'm not comfortable doing it. I know someone who can do it, and he's also part time here. So patient feel it's like a reverse psychology, right? They know your limitation. They know that you're honest with the limitation, so they think you are trustable. So in order to build this whole thing up, I have to have a relationship with more capable than this who are willing to work with me. And then when the patient come in, I don't think I'm comfortable doing this case, and I want to pass him to somebody I trust. So I'll pass to the person I work with. So that I think
It's very good what you are doing. I mean, by being transparent, in fact, you build more trust.
yeah, exactly.
Right? There are a lot of entrepreneurs out there that they try to present a larger than self image, right? But what they don't realize is that people out there can actually cash it. It is actually better to be transparent and vulnerable. That people felt like you're actually genuine, you are someone that they can trust, right?
Yeah.
Someone that you can depend on, and that actually keep your customers keep coming back for the long run.
Yeah, exactly. The wrong one is the right word. The ultimate question is, if let's say those entrepreneur, their goal is to make this much money in this year, so probably what they're doing is right for their profit term. Ethical, here we don't talk about ethical first. So for business wise, they're probably doing the right thing. But we are talking long term. Like you say, trust is basically trust and relationship is basically a thing that drive a longer way.
True. I think people have to be clear whether you are playing the short game or the long game.
Yes.
There is difference in that, right? So before we go further on the business side of it, I know we are kind of like over time, but we had a good time. And how about we answer Feng Chen question, right?
Sure.
What is your opinion in integrating hypnosis with dental works? Is there anyone that you have met globally that have actually been doing that?
We have that in Malaysia.
Okay.
I
How
went
does that work?
I went to a seminar or a half-day workshop. Video. They hypnotize a person, and then basically a person without any anesthesia, they didn't give any numbness. They hypnotize a person. They call it a trip. Like you go for a trip like that. So basically, it's a virtual trip. They try to hypnotize you. You go to your favorite beach. You're hearing the wave and everything, and then the doctor start to operate on his hand, like cutting his hand, putting suture and everything. And then after about an hour, they just tap him and wake up, and then he didn't feel a thing. So it's recorded with no video editing. So this thing does exist, but it's very, very, very depend on the patient. So for a patient to be able to accept hypnosis, is a small portion. And within that small portion, there's only a smaller portion that can be hypnotized that deep. They say that hypnotized, how deep can you go?
Yep.
In order for us to do a really painful thing under hypnosis without the patient feeling painful, the patient really have to go deep into the hypnosis. And there is still no very efficient or effective way to find out whether this patient can go that deep or not. So it's really troublesome. For us, it's just easier just to give a jab and then we can do our thing.
The old way, right?
Yeah.
I think hypnosis actually is not to say it's a new thing that has been around for quite some time. There is of course the question of the how educated are people on hypnosis, right? There is a stigma regarding that, and they watch a lot of movies. People have a certain idea about what is hypnosis that is totally different from what we are doing in the class, right? Yeah, people think it's like a magic trick, and you talk about the how deep they can go. That is basically like how deep they can go into the trance, and
Correct.
sometimes the patients might have resistance. So it also depends on how adept you are in hypnosis. But is that a legal agreement from the client to actually use this in treatment?
I think it's very similar with most of the treatment. Means every procedure we do, we sign a consent with the patient as long as what is stated in the consent is exactly what the dentist or the hypnosis is doing. Then, so it's basically like any other consent, I think.
I see. So how about yourself? Ever thought of taking on hypnosis to complement the skill set?
At the moment, no. At the moment, no. I would
Just a
focus.
jab for now.
I'll focus on how to build the business up first.
True. Okay. Perhaps you can share with us from the many dental practices that you have solved and experienced yourself, right? What is it that sets apart those that are successful and those that are not? Are there like a few key criteria that stood out for you?
Okay. Depending on which angle we are looking at it. If we are looking at business point, of course, profit. Then dental clinic is making profit is a good practice because and making profit for a long time consistently. Because dental clinic want to make profit for a long time, they have to have a certain reputation. And if they are not doing good dentistry, they cannot have this reputation and they cannot last for a long time. So if a is consistently growing, it can grow very slow. You don't need to grow very fast. If it grow consistently and then making profit every year, the best is over 10 years. Means they go through the whole cycle. I consider successful. But if we take on to a personal level, how would a dentist to become successful for me is that they have to enjoy their work and they really don't mind working. Therefore, a lot of my friend, a lot of my friends would say, "Oh, you good lah, you open dental clinic already." So I told them the case in dentistry we go by commission based. Means if we call it sales. Means if I see a patient today, the patient say 200 ringgit for, and then depending on the commission set, I'll get the commission. So in that, I think we are the industry that give the most commission. Our commission rate between 30 to 50%. But I haven't heard any industry give that high commission before. dentist is the one that have the highest commission.
So now it's a pitch for people to become dentists.
Yeah. So they think that it's very fun to start. It's like sure make money like that. But then tell them if this month my sales is 20,000, I get 40%, so my salary would be 8,000 ringgit. If I'm working for somebody, right? But now if my sales is 20,000, I still have to pay money on top to maintain the overhead. So it depends. If a dentist really want to open a practice, then if they open a practice, they run it well, they're happy, then they're successful. If a dentist want to have a simple life, stable income, and then dentists usually won't starve to death. Dentists usually can live quite okay, right? Compared to a lot of other. But dentists can't become filthy rich. It's very difficult for a dentist to become filthy rich. There's like a 24 hours. There's only so many patients you can see, right? If people
need you to be there, right?
Exactly. So if people want to have a simple life, somehow they choose to become a business owner, and then even the business start making money, but they still have a miserable life. They don't like to teach the staff. They don't like to do the admin. Then probably I wouldn't consider that as successful. But again,
they are dental franchises, right? Isn't it?
Sorry.
There are people that actually have dental practices that they actually like turn it into a franchise or something.
Oh yeah. So that is yes, that is on a different side already. That basically their goal and their strategy, what their primary objective is different already. That is like a tip, right? So when you are working for somebody, you value the business like that, and then you want to have very good treatment, like very good experience. This is your priority. But then when you become a business owner, it's sort of like 50-50. Doesn't mean this is not important, but this has become as important. But then when you become like a top management level of a chain practice, let's say you have 50, 60,000, 50, 60 clinic,
yes,
this has more priority. So doesn't mean that all of them do bad treatment. I know them even in chain practice they do good treatment, but at the management level, they have to set a higher priority to the business vitality compared to those people just working for somebody.
I think that is the difference between whether you are the manager or whether you are the technician. Of course, they all have different priorities and different roles, right?
Yes.
So, you also mentioned about getting sales and stuff like that. There, of course, we realize that there are actually some clinics where the idea is to open the door and wait for people to walk in. But is there any proactive marketing strategies that you are currently using or that you have seen people use successfully to generate leads for the clinic?
Marketing, I think I'm not the right person to answer, say what I've been doing. I since Quest Center is built based on relationship and trust, so my strategy was to just go socialize, to network, to get to know more people, joining clubs. That is my first priority, and I would say now in my BNI chapter, I think quite steady there means people know that I'm a dentist, and then
You're the only dentist.
yes, and then if they have any case, they will refer to me. Means I think my reputation there has built up to a very stable, so I don't need to put in a lot of extra effort already. So now I look into the other part, which one
Other
of
channels.
the BNI friend advised me to try Google Ads, and I tried it, and it's quite, the response is quite well. The first month, I think I put in 1,200 ringgit for advertisement, buying keywords, and I generated around 4,000 revenue. So I thought that was quite good. And for the past few days, now it's COVID. They don't know which clinic they are closed, right? So I get at least 3 or 4 patients over the last week from Google. So that is something I did as well. And then awareness. I think for people who doesn't know that dentist is important, if you become the first person who changed their mind, you probably would be their preferred dentist. So this was my belief. So now I started to make videos, raise awareness. I'll see how it works on. Maybe next time.
I mean, everyone is now. Yeah, sure. I think we actually overlook a component of what you are currently doing. We have talked about the business of dentistry. We have talked about your clinic, but we have yet to touch on dental genesis network. What is the network of dentists that you founded, right?
Yes.
What makes you want to do that? What's the objective?
The story was I graduated and then I had to work for government, right? So when we work for the government, we sort of have quite a lot of extra time because we work 8 to 5 o'clock, and then we have all the public days we have leave. So I wanted to do something else. And I spoke to my mentor, and then I said, why don't you start? Because before that, I tried to start some society or association before. So he said, why don't you start one for dentists? So I said, you look into it, and ding ding dong dong, ding ding dong dong, it ended up to be Dental Genesis Network. So essentially what Dental Genesis Network do is we gather dentists, and then we run like a study club, means we gather together and then we study on something. So what do we study? We don't really talk about how to do root canal, how to do braces, how to do implant, because there are tons of courses out there. We mainly talk about personal development, clinical management, means come in, how do we manage the patient, and then we talk about the business side of dentistry. So these are the 3 focus that we focus on, which is also all 3 of them are not touched either at all or just very lightly touched in university. But it's essential for dentists. So we started that. And I sort of have an interest in this side, like personal development and business side of dentistry. So it's a good practice for me.
I actually saw a lot of events that Dental Genesis Network actually held. Basically, you guys gather people for all this networking and education. How many members do you have so far in DGN?
The first
Is there like
year,
a membership? Is there like a paid membership? Is there like a weekly meeting?
we started very unofficially for the first year. This year, the first year we started unofficially. There were no company. It's like everybody come gather money, and then we rent a venue, and then we invite speaker come and speak, and then we go touch with the food. We pay for our own food. That's basically what it was. And then the second year we set up a company. Then it became more structured. We plan out we set a team for the year. So probably the team of is to be an extraordinary private dental practitioner. So then every month we will have one session, and the session could be a speaker's night, means we invite speaker to come and speak, and then we have interaction. It could be a visit to dental practices. It could be a study trip. We go down to Singapore and then we visit dental clinic there together.
Mm-hmm.
So we plan out the whole program, and then we show the program to the people, the potential participant, and then tell them this is the price, and then you can join for this ringgit for this year.
Mm-hmm.
This program usually exclusive for the member, but each member can bring a number of guests.
I see. I see. I think perhaps for those who are actually dentists or aspiring dentists that wants to be part of a dental gymnastics network, I think later Dr. Billy can share the link below as well, like the comment section, so that you all can have a look into what the DGN is doing. So to sum up what we have been doing, what we have been discussing for the past an hour plus,
Oh yeah.
we have actually talked about Dr. Billy understanding of dentistry. We talk about his experience visiting different dental practices. We talk a bit about the technical side of dentistry, like what are the specializations and what do dentists actually do, right? But at the same time, we actually discuss on the business side of it, of the dental business, because a lot of times when people are being exposed to videos of specialists like this one, they always talk about the technical side of it. There are so little information out there on how they can actually start a successful practice themselves, right? And I love the fact that you actually started a supporting association of sorts, a networking group for dentists to actually comes together, where they can inspire each other and share the best practices. Because like what you have mentioned, right, we have go so far beyond just performing the job. Right now, we are providing a wholesome service, right? A very holistic service to our clients, and that is the way forward for the dentistry industry, right? I believe we are
Yeah, I
still
believe so.
rather green here in Malaysia. I think a lot of exposure still needed. Okay. Well, to sum up this very educational session we have with Dr. Billy today. So say there is a young dentist that is watching this interview, and he wants to know how he can be like you, to go from fresh from the university and for the past few years actually build a network of dentists and to leverage on networking until today where you can start your own dental practice. If you can go back to who you are back then when you are younger, how would you do it differently? What are the key steps that someone must take to be where you are today?
If I can go back with the knowledge and experience I have now, first thing I would do more is I would talk and communicate more with my family, because I mean in university time you think that your family is quite, you don't want them to know too much about your life. That's very crucial for whoever want to start a practice. Support from the family is very, very important. And one day you just out, I want to start a practice, they wouldn't understand. But if throughout the journey you let them know what they are doing, what you are doing, what you are thinking, feed them bit by bit, so they really get to know you. That would be a tremendous help. So I probably would do that a little bit more. And then I probably will pay a little bit more attention in class, because if I pay more attention in class, it will be easier for me when I come up to, after I graduate. When I take courses, there are things that I need to have a strong foundation to understand, or to do well. I had some of the courses I had difficult time, so I had to pay more attention on it. So if I had a good foundation in university, probably I would do better. The other thing is, I hope I started to go networking earlier. I mean, knowing other people really changed how I see myself and how I face problem. So I guess if I started that earlier, I come to that realization earlier, I would have more time to strategize and do the right thing. So these are a few things.
Very valuable you have shared. Basically, the value of relationships, the value of networking, and the value of paying attention in your class.
Yes.
Getting good foundation, right?
Yes.
Okay. One last thing. What is your message? What is the message that you want to tell to all our listeners today who's been following us for the past hour?
Oh, already got people listen the whole thing. Wow, thank you everyone. I really believe that in any situation, there are good and bad. It's to focus on which one we want to focus on and how much we want to focus on one or another side. There are things that we can control. There are things that we cannot control. If we keep looking at things that we cannot control and keep whining on it, nothing will be changed. So why don't we focus on ourselves? I believe that if everybody mind their own business, be a good citizen, do good business, be a good person, I think the world will be a beautiful place.
Thank you, Dr. Billy, for a very refreshing, very entertaining session that we had today. I mean, everyone is in our MCO and it's at home. So I hope your sharing has brightened many people's days and evening today. So perhaps for those who would like to reach out to Dr. Billy, whether for his services or whether to join his dental gymnastics network, later Dr. Billy would put his perhaps his contact or Facebook page below so that we can reach out to each other. So with this, thank you, Dr. Billy. Thank you for being with us today. A great session.
It's fantastic.
Yes.
All right, thank you, everyone.
We've learned a lot. Yes, thank you. See you and take care. So we have more speakers upcoming for the rest of this MCO, so you can stay at home, be entertained, and be educated. So
Yes,
stay tuned.
definitely.
Yes. So yeah, do follow the page and do follow Dr. Billy. We will keep you posted from time to time. So stay home, take care, and
before you go, before you go, guys, do follow Terrence because Terrence also one of the person that inspired me to do better. I also don't know why he go and join Rotary Club and he really put a lot of effort. But what I believe is if people spend extra time to help another person, that person is going to do well. And I think Terrence is one of those people.
Thank you for the beautiful testimonial. I think there's a quote that I always remember, right? That is, although we can't do all the good that the world needs, but the world needs all the good that we can do. So
Yes.
I hope we our audience with that. So let's work together. Let's stay home, and we can get through this soon enough. Stay safe, guys.
Awesome.
Take care.
I see.
What do you want to see?